All right, we're here for a testimonial on what our chronic knee pain program did for this young man. And who do I have in front of me?
This is Frank Limburner.
And Frank, how long have you had knee problems?
About a year and a half.
And can you describe what it felt like with your particular knee problem?
Mostly I would notice very severe pain after a round of golf, and it particularly was on the inside of my knees. Difficult in walking, but if I was at rest they were okay, but movement would cause severe pain, as I say, particularly on the inside of my knees.
And so at golf you kind of got to walk a little bit, so that would make it a little more difficult on your longer courses?
That's right, and I went to wearing braces, which helped.
What other activities that you wanted to participate in did you find that your knee problem was giving you problems with? Like travel or anything?
Travel was okay, but certainly going downstairs was very bad. Going up, not too bad, but very bad going downstairs. Obviously, I wasn't going jogging or anything like that, because that would have caused or did cause severe pain. So, not that I'm a big jogger, but
right.
Certainly I could not do that.
Right. And then, did you have any pain at all with driving?
Yes, and a lot of times thank goodness for speed control, because I could get my legs into a position where I could get relief. Also, particularly when I got out of the car after sitting there for an hour or two, very difficult to get moving. Once I got moving, it wasn't too bad. Okay,
so now, what types of things did you try to do to get help with your knee prior to coming to see us?
Really didn't do much. I had x-rays, and the result of those x-rays indicated that I probably was a good candidate for knee replacement surgery. And I guess that at that point in time, that's when I came to see you.
All right. And so then you started our knee program, which comprised of several different things. We work on the whole nervous system from the spine down to the toes, and then occasionally we had to do some mechanical adjustments to the knee as well. And how did you find that experience? Was it comfortable, the whole process?
Absolutely no pain involved in the whole process. One of the things that besides the pain in my knees, I had very little sensation, let's say numbness, in my lower legs, and through all the treatments, that feeling has come back, and maybe not 100%, but certainly come back a lot.
Right, so that's the beginning of peripheral neuropathy, that when you lose the sensations is with peripheral neuropathy. You start losing things, and then you start gaining things like pain and balance problems and stuff. So it was good that we got to that on the early stages. And then, so on a 1 to 10 scale at this point in time, what would you say as far as your pain is now?
My pain in my knees is probably 0. The only time that I will have pain is if at night sleeping, if I want to sleep on either side and put pressure on the inside of my knees in the matter of 15 minutes or to an hour, I will have pain, and I have to go back to sleeping on my back. And that's the only way I try to sleep, is on my back. And when I do that, I do not have any pain in my knees.
And the pain beforehand was, what would you say is worst?
Oh, well,
on that 1 to 10 scale?
Yeah, it would be probably an 8 or 9. Again, I said I wasn't in pain a lot of the time.
Right.
Yeah.
But when you were, it was quite significant.
Yeah, right.
All right. So, and what would you say about someone who's considering doing some kind of additional thing to help their knee besides injections and surgery? Do you think this would be a viable option for them?
I think so. It certainly has worked for me. Anybody with my symptoms similar to me, I'm sure it would be very successful.
Very good. Well, we appreciate you taking the time to share how the program's worked out for you and so forth. And you have a great day.
Yep, thank you.